Surgical bleedings. In this video, we'll be discussing about the surgical bleeding. First of all, we'll say what is hemorrhage. Hemorrhage is nothing but bleeding. Bleeding may be physiological or pathological. Physiological always seen in a females, not in a male. Females will be having menstrual cycle every month. That bleeding is known as physiological bleeding, as it occurs in every person, every female. So this is a physiological. Any other than this menstrual bleeding, any other bleeding, anything may be cut due to trauma or anything, it comes under pathological bleeding. These are the types of bleeding, and the bleeding may be classified into other types also based on the bleeding we can see or not. This is external bleeding and internal bleeding. Internal bleeding which we cannot see, whereas external bleeding which we can see. Still, how to assess these internal bleedings? Internal bleedings which you cannot see. So we have to check for the vitals. Vitals, you will see heart rate and blood pressure. If blood pressure is decreased, there won't be, because of this blood loss, there will be decrease in the blood pressure in bleeding, and increase for as a compensatory mechanism, there will be increase in heart rate in order to supply the blood to the organs. So there will be increased heart rate as a compensatory mechanism in case of bleeding. So internal bleeding is also known as concealed bleeding. You have to check for the vitals, that is heart rate and blood pressure. Because of blood loss, there will be hypotension, loss of decrease in blood pressure. As a compensatory mechanism, there will be reflex tachycardia. Tachycardia means increase in the heart rate in order to supply the blood to the organs. To overcome this, there will be compensatory reflex tachycardia. You can see these are the types of bleeding based on the bleeding which you can see or which you cannot see, that is external and internal, which is also known as concealed bleeding. Next, when you see this condition, there is a decreased blood pressure, that is hypotension, and increased heart rate, that is reflex tachycardia. You call it as a shock. This shock may be occur during the surgeries, where because of this shock is also known as hypovolemic shock, as because of massive blood loss during surgeries, the patient may undergo shock, finally leads to death. If you think you had a cut on your wrist or somewhere, if how to know whether the cut is on the artery or vein? If it is arterial cut, arterials supply blood from the heart to the organs. So artery is coming blood from the heart, which is pumped. So pumped means more force will be there. So more pulsatory, like jet-like bleeding will be there. Whereas in vein, there will be continuous, no pumping movement will be there. So there will be continuous bleeding will be there, and slowly the bleeding will be there. Whereas in small vessels, like small vessels means capillaries, where there is a superficial cut, there will be generalized oozing out of the blood. These are the types of, like, you can distinguish between the bleeding from which the blood is coming, whether it's from artery, vein, or from the small vessels like capillaries. During what is the other type of bleeding is surgical bleeding. What is surgical bleeding means any bleeding which occurs during surgery or after surgery is known as surgical bleeding at the surgical site. Now we'll discuss briefly about the surgical bleeding. Surgical bleeding, there are three types: primary, reactionary, and secondary. Primary, reactionary, and secondary. Coming for primary bleeding occurs during the surgery, during the cut. From where the blood is coming, that is known as bleeder. Any vessels from where it is bleeding, that is known as bleeder. This is a cause. And then how to treat means we will be the blood vessel will be visible, the bleeding blood vessel will be visible. We have to ligate the vessel, or else if it is a very small vessel, we have to catheterization should be done for the small vessels. If it is a reactionary bleeding is nothing but any bleeding which occurs at 4 to 24 hours after surgery. This is known as reactionary bleeding. Because of the cause for this reactionary bleeding might be insecure knot. They'll put knot, or they will ligate the vessels during surgery. If this knot is not proper, this knot is not secure, this will be slipped off and causes there will be slip off of the ligature or the knot, which causes massive bleeding because during the surgery the blood pressure will be decreased, so that the blood loss will be minimal. But after surgery, the blood pressure will be increased when the anesthetic effect is lost. So there will be massive bleeding in case of reactionary bleeding. So what you have to do, the treatment, we have to take them back to the OT and then religate or re-explore where there is a bleeding and then religate at the surgical site. This is a treatment in case of reactionary bleeding. Coming for the secondary bleeding, this occurs after 24 hours or within 5 days from the surgery. This is due to the infections at the surgical site. And this infection, how it bleeds means it causes damage to the blood vessel wall, so there won't be only there is a damage here, there is a ligature is flipped out, so the entire lumen is exposed. Here only there is a damage to the blood vessel wall, so there won't be any massive bleeding, there will be only mild bleeding in this case. This is because of infections. We can give antibiotics. Antibiotics we are usually like we have to apply like give very quickly, so we give IV patients. IV antibiotics is not given for OPD patients, so we need to admit the patient first and then give antibiotics IV in case of secondary bleeding. This is all about the types of bleeding, causes for surgical bleeding, what is surgical bleeding, and what is hemorrhagic shock, all and how we will manage the conditions. If you find this video helpful, please do like, share and subscribe to my channel, and if you have any suggestions, let me know in the comment section. Thank you.